All right, I think we can all agree that staying healthy is important, and when something isn't quite right, you turn to the professionals. Here with more is board-certified urologist. We're talking to Dr. Dr Cesar from University Urology. Good morning. So great to have you on.
Good morning. Thanks for having me.
Pleasure to talk to you this morning. We're talking about BPH this morning. What is BPH?
So BPH stands for benign prostatic hyperplasia. It's a benign process, which means it's not dangerous. And it happens to most men as they get older. As they get older, their prostates get larger, which causes some symptoms that cause them to come to a urologist.
Okay, and how is that evaluated?
So most of the time, most people go to their primary doctors and they might complain about waking up at night to pee a lot, a slower stream, not feeling they're emptying their bladders all the way. Then they get sent to a urologist. The urologist will sit down with them, ask them about those symptoms, kind of take a log of them, do an exam in the office, and then kind of give them tips and other things they can do about what tests they can have done to try and figure out what's going on.
We were kind of joking about, you know, it's just another symptom of getting old. These things happen.
Oh,
It's
yeah.
the age, it's the pits. But
Oh, yeah.
the good news with BPH is that it is treatable. So what are the treatment options?
So it's a completely benign process, and after you talk to your urologist, he'll give you some tips about what to do to kind of help yourself, which is, you know, actually drinking more water, trying to empty your bladder more.
Okay.
You know, cutting off drinking liquids though after 6 p.m. so you don't wake up at night as much.
Okay, probably things we should all do anyway, right?
Yeah, but things that can kind of remind you.
Okay.
And then after that, there are medications. Simple medications have been around for a long time. Some of them can shrink your prostate, make it smaller so it's easier to urinate, because the prostate actually surrounds the urethra, which is the tube you pee out of. So if you can shrink it, it makes it easier to empty your bladder. There are also other medications that kind of relax the muscles around to make it easier to empty your bladder as well. If the medications don't work, then the urologist can talk to you about therapies and other minimally invasive things that can be done to kind of reduce the volume of their prostate, which is, you know, in the old days, they used to scrape it out, kind of a roto-rooter kind of thing to kind of scrape out a TURP, if you will, a resection of the prostate. Now there are newer technologies. I personally use a green light, so it's actually a light that actually vaporizes the prostate, which kind of debulks the prostate in order to make it a lot smaller, so you're urinating kind of like you were younger again.
Make it a little bit more comfortable. Well, it's good to know that there are treatment options out there, Dr. Cesar. If somebody wants to learn more about you, maybe has some questions about BPH or anything else kind of going on in their lives, how do they get in contact with you?
So I have 3 offices. My main office is here in Cape Coral, but I also have offices in Fort Myers and also North Fort Myers.
Okay.
I'm always willing and happy to talk to everybody. The best way to get in touch with any urologist, me or anyone else in the area, is to talk to your primary doctor. That's what I always tell people, because you know, they're kind of the gatekeepers to see what's going on. But after you talk to them about what's bothering you, they'll send you over to me or someone else, and you can talk about your symptoms, and we can get started about what to do to help you out.
You can also get started by going to his website as well, which is universityurologyfl.com, so be sure to check him out online. Great to chat with you this morning.
Thanks for having me.
Good to see you. You can also learn more by going to our website, which is fox4morningslyn.com.